There has been a surge in alarming news regarding controversies of vaccine use as well as disease outbreaks with the recent NCOV scare. This has created a distrust of medical therapies and a damage to the public health image. There are many diseases that can be prevented with vaccinations. In this video, we are going to discuss common skin ailments afflicting unvaccinated children such as measles and chickenpox. Chickenpox or varicella is caused by varicella zoster virus. VZV is transmitted via airborne droplets and direct contact with an incubation period of 2 weeks. VZV enters through the mucosa of upper respiratory tract and oropharynx. VZV then infects the tonsillar T cells. This is followed by local replication of the virus in URT and oropharynx. T cells then disseminate the virus via blood and lymphatics, resulting to primary viremia. The infected T cells will carry the virus to reticuloendothelial system and skin where innate immune responses such as interferon release and activating NK cells and developing VZV-specific immune responses initially delay the viral replication and rash formation. Subsequently, the viral replication overwhelms host defenses, resulting to secondary viremia. The virus then circulates in mononuclear leukocytes, primarily lymphocytes. This will lead to prodromal symptoms such as 2 to 3 days of fever, chills, malaise, headache, anorexia, severe backache, sore throat, and dry cough. After this, the rash begins to appear on the face and scalp and spreads rapidly to the trunk with relative sparing of the extremities. The progression of these skin lesions is rapid and occur in less than 12 hours. Initially, they appear as rose-colored macules, become papules, vesicles, pustules, and then into crust. There is a simultaneous presence of lesions in all stages, and as new lesions appear, fever persists. The crust then fall off spontaneously in 1 to 3 weeks. Subclinical infection may also occur after the appearance of prodromal symptoms. Vesicles appear in mucous membrane of the mouth, nose, pharynx, larynx, trachea, gastrointestinal tract, urinary tract, and vagina. Afterwards, host immune responses terminate viremia and limit progression of varicella lesions in skin and other organs. The patient will then develop cell-mediated immunity that persists for many years, protecting the patient against severe infections. However, there could be a reactivation of the virus in the presence of risk factors such as immunosuppression, local trauma, and irradiation, leading to a more severe form of disease called herpes zoster. Another disease that is rampant in our country is measles. Rubiola, also known as measles, is a highly contagious viral disease caused by Measles virus. The virus is transmitted via droplet, airborne, and direct contact, and it has an incubation period of 1 to 10 days. Measles virus enters through the respiratory tract. It infects the mucociliary epithelium or alveolar space. It may also enter through the conjunctiva and invade the space between the cornea and eyelids. It then binds to the dendritic cells and infects the CD150 lymphocytes. These cells will spread the virus to the regional lymph nodes by way of lymphatic systems. The virus then enters the bloodstream and spreads hematogenously, resulting to primary viremia. The virus continues to replicate in the epithelial cells and reticuloendothelial system, resulting to secondary viremia and disseminate throughout the body. Persons with impaired cellular immunity may develop giant cell pneumonia. After the virus has spread throughout the body, the infection starts, resulting to activation of natural killer cells and increased production of antiviral proteins. This is followed by the prodrome period that occurs in the 8th to 12th day. Patient will experience fever and malaise, followed by cough, coryza, and conjunctivitis. On the 13th to 14th day, Koplik spots appear. On the 14th to 15th day, maculopapular rashes erupt. These spread centrifugally. There will also be depressed responses to unrelated antigen, leading to immune suppression that results to enhanced susceptibility to secondary infection such as pneumonia, diarrhea, and otitis media. The decrease in responses could also suppress the delayed type hypersensitivity response and impair the cellular and hormonal responses to new antigens. Activation of natural killer cells and increased production of antiviral proteins will also result to periventricular demyelination that could induce immune responses to myelin-basic proteins via molecular mimicry, causing serious complications involving CNS. Although such childhood diseases may be alarming, these are largely preventable with simple vaccination programs. Our objective is to improve vaccination awareness by conducting a health lecture in order to curb this misunderstanding. Our target audience are mothers, as they are the decision makers regarding vaccinations of their children. Our group organized a public health lecture that provides basic information about vaccine, the common beliefs and stigma that comes with it, and basic information regarding viral diseases that are rampant in our country, such as measles and chickenpox. We also held a mini Q&A portion to make it more interactive and also to answer some confusions with the said topic. To further facilitate the spread of information, we provided flyers for the families as well. Vaccines are not the enemy, and we are inclined to break the rising public stigma with our advocacy, Bakuna para sa atua.